and welcome to another interview in our series of Let's Talk podcasts. From substance use prevention to quality research, treatment of addiction, and recovery from it, these award-winning podcasts focus on the issues of importance to Hazel and Betty Ford, issues that we know matter to you too. I'm your host, William C. Moyers, and yes, it looks a little different around here today. As we all know, a lot has changed in the world since our last round of podcast interviews back in the winter of 2020. Hazel and Betty Ford take seriously the need to do everything possible to prevent the spread of coronavirus among our patients and our employees. Even here in the studio, we are following public health guidelines. As a result, I can take off my mask because the production crew, the executive producer, and yes, even my guest are elsewhere in the building. Today we are joined by Dr. Tim Portinga, the manager of mental health services at Hazel and Betty Ford's Youth Center in suburban Minneapolis. Tim has been with our organization since 1999, and he brings vast experience to our topic, mental health issues and emerging adults. Dr. Portinga, thank you for joining us today.
Thanks for having me. This is fun.
And you've been around a long time. Tell me, where does your interest come in terms of emerging adults and mental health issues?
Yeah, thanks for asking. So there's an old joke out there in psychology land, and that is that if you find a therapist, if you scratch him, underneath you'll find a client. And it's absolutely true in my case. The adolescent, early adulthood years were characterized by an awful lot of up and down, and I have a soft spot in my heart. I hope that doesn't sound too trite, but strong empathy for young men and women that are going through those developmental issues. And truth is the truth, I really enjoy being able to see kids make quick turns around. That's one of the fun things about working with young people, is when their motivation is intact and they're really interested in making a change, you can really get a hold of them and you can do some excellent work.
Well, thanks, Tim, for your authenticity there, and thanks for the good work that you're doing, because you are making a difference. Emerging adults, what does that mean?
It's a newer term out there in psychology land, but essentially it's trying to put together the term adolescent and young adult. So technically we're talking about roughly the 15 to 23, 24 range. Maybe more accurate to talk about adolescents and young adults, but frankly they have more in common than they have differences. So I think it's a good way of describing those folks.
Would you say, Dr. Portinga, that emerging adults today are experiencing increased mental health concerns compared to earlier generations?
Yeah, and it's difficult to describe to folks. I think just about everybody thinks about their own experiences. That's kind of the lens that they use when they think about mental health concerns. But research in the last couple of years have been really strong indicators. APA, American Psychological Association, recently did a 10-year review survey looking at all ages across the spectrum in terms of increase or decrease in mental health kinds of symptoms. And interestingly, the 15 to 23 year range had the highest increase in mental health concerns of any of the groups, and mostly around depressive and anxiety-based symptoms, which of course is dramatic because that means also there was increased symptomology around suicidality. But kids are really stressed. It's a real thing.
And they were stressed even before these times. And by these times, here we are in the summer of 2020. We've had this pandemic now for several months that's turned the world upside down. And even in recent weeks, we've had the civic stresses of what's been happening in America. Would you say that those are going to probably lead to heightened awareness among emerging adults around those stresses? And actually, will they be feeling those stresses due to what's been happening?
Yeah, and the research is still coming in, of course, but absolutely by seat of the pants experience, we know that this is going to be a very significant stressor for young adults. You know, this is a prime time for development. One of the biggest things that young adults use for their developmental experiences are their experiences with peers. And right now they're isolated. They're not having a chance to have those normal types of experiences. They can't compare and contrast where they are as easily as they used to be. It's such an important thing, that not only the loss of peers in that positive sense, but just the isolation.
Yeah.
Very difficult thing for young people to endure.
And then, of course, technology, as parents, we were concerned about technology taking over for peers or filling that void before we all had to go virtual.
Yeah, and technology has its own pluses and minuses also. There's an awful lot of research out there that ties social media work to increased levels of anxiety and depression. And if you can just bear with me for a minute.
Please.
If you can imagine yourself as an adolescent sitting in your dark bedroom, 11, 12 o'clock, 1 in the morning, scrolling through Facebook or other sorts of social media pages, what you're seeing is your friends having their best times ever. They're on vacations, they're having wonderful experiences, they're with their pals, they're partying, whatever that situation might be. And the strong temptation, of course, is to compare it to your own experience. And here you are sitting by yourself in this dark little room, right? Bored. So whenever we compare ourselves to other people, we almost always misinterpret how those situations compare up, and we usually feel slighted, and that's an experience that an awful lot of kids are having right now.
So let's talk just a little bit. We could talk forever on this, what you just mentioned, but how important are peers to emerging adults?
That's date myself a little bit here. That's a $74,000 question right there. So one of the things that parents will often struggle with is the fact that as kids go through this developmental process, at some point peers become almost more important than they do. Their allegiance to their peers, the way they take their peers' interactions, the feedback from the peers becomes one of the biggest factors. Often that's a hard thing for parents to let go of or to accept.
That's very, very interesting. What should parents be watching for in their teenagers or their emerging adults, young adults?
So one of the first things that will usually happen if young people are starting to struggle with mental health symptoms is that they'll start to isolate. They'll spend less time with family members, less time in school-related kinds of activities, extracurricular kinds of activities. Of course, there's just the simple symptom, but kids will start to look sad. They'll have less fun, they'll be less engaged with formerly pleasurable activities, they'll start to let go of things that they used to enjoy. And then you sometimes will get some irritability mixed into the fray. Sometimes that seems kind of paradoxical, but often anxious or depressed young folks will start to express that in increased irritability, anger, frustration, much lower tolerance for day-to-day kinds of problems, which again, classic in relationships, right? Because in relationships there are always ups and downs.
And then of course we have substance use,
Yes.
and that's always known to be a red flag. How does substance use figure into the mental health condition of an emerging adult?
That's been one of the big things that Hazelden Betty Ford has really focused on over the last 10, 15 years, and that's really been captivating for me as a professional in the field. We always had the big silo thing going on. We had this idea that if people would just get sober, their mental health issues would go away. Or coming from the other side of the fence, if people just would deal with their depression and anxiety symptoms, they wouldn't need to medicate their emotions anymore. They wouldn't use so much, or maybe their substance use issues would go away. But the truth is, it's never been either or. It's always been both and. And best practice for treating young people particularly is to address the depressive and anxiety symptoms. Those are kind of the predominant types of concerns that we have, right alongside the substance use disorders. And typically what we see in a treatment setting is that from day to day the issues can change. Some days it's about relationships, maybe it's a phone call from a peer back home. Some days it's going to be about anxiety about what's going to happen to me after I get out of treatment. And that anxiety can be overwhelming and it can cause them to think about using. And they start heading for the door, they want to get out of treatment, right? To deal with this anxiety stuff. Oftentimes it's thinking about using, which tends to make them nervous. So you have to deal with both simultaneously as much as you can.
Are teenagers using more substances today being the summer of 2020, than they were when you started in this field back in '99 at Hazelden Betty Ford?
From a big standpoint, the answer is sort of a qualified no. Substances, in terms of the sheer number of people that are using substances, have stayed relatively constant. some changes, percentage points up and down over the national spectrum over the last years, but what they are using has changed dramatically. And just to go from my own experience, when I started in the field, the majority of my patients were abusing cannabis and alcohol, and they were playing with other drugs from time to time as opportunities would provide with the younger crowd. I saw the figures just the other day. I had about 4% of my patients in the early 2000s that would identify opiates, some form of opiates, as their primary issue. It was rare. Now, I saw just a year ago now, it was at 37%. 37% of my patients identify opiates as their primary drug of choice. That's a dramatic difference. Not only in what they're using, but the lethality, the long-term consequences, the destruction that happens around them. It's a much more significant problem.
And what about the legalization of marijuana across the country? What sort of messages is that sending to emerging adults, and what is the result of what they're seeing and hearing?
Sure. So the more cannabis is available, the more people will use cannabis. Research is showing that in very strong ways. And the more it's available, the more it's legalized, the younger the people will be when they start using substances. So one of the trends that we've seen across the country is as more states have legalized substances, we start to see the age of first use decrease. Now this is a significant problem because, again, based on research stuff, we know that the younger somebody starts to have problems with substance use, the much more likely they are to have problems long term. The chronicity levels are much higher, the levels of long-term dependence are much higher. So long-term, it's a political football, of course, and it really bothers me because it should be a science problem. It should be a research and academic-based issue, but it has become a political football. And that's unfortunate, it really is.
We only have a couple of minutes, Dr. Portinga. I want to bring it around to a message that helps our listeners and our viewers to have some hope and to know what to do next. I mean, we've got this pandemic. We've got the viral nature, if you will, of what's happening in the streets across the country. We've got students who are in school but not in school. We've got technology becoming even more ubiquitous, if that's even possible. The stress of the country is higher than it's probably been in a long, long time. What is a parent or a grandparent to do if they are worried about their emerging adult or their teenager?
I think the starting point always has to be communication, that communication, empathy, compassion piece. I think parents need to understand that it's not only difficult for them, but it's doubly difficult for their young folks. And they have to be super careful about listening in empathetic, compassionate kinds of ways and gathering information. I think the communication piece is something that we talk about so often in so many different fields, but particularly in mental health. I think it's one of the most underutilized skills, and it's a skill that's readily used. And it's something that I always want to emphasize with family systems.
And in those family systems, the communication that you're talking about is around the table or on the boat or in the living room. It's not communication by text or by voicemail, it's face-to-face.
Absolutely so. And one of the things that's the hardest for me in the virtual world is trying to get those second and third and fourth level impressions that you get from being face-to-face with someone. I'm a professional, I've had some experience with this, I hopefully can do it a little bit better than other folks, but I would emphasize with family systems that it's completely important to have that face time. That closeness, that proximity is just irreplaceable in a family system.
Well, thank you, Dr. Tim Portinga, the manager of our mental health services at our youth facility in Plymouth. Thank you for bringing not only your expertise, but your articulateness to it and the passion for what you do. We really appreciate it.
Yeah, you're welcome.
And thanks to all of you for joining us. Be sure to tune in again for another edition of our regular podcasts, Let's Talk. On behalf of our executive producer, Lisa Stangl, and our podcast team from Blue Moon Productions in the Twin Cities, we want to remind you to stay safe and stay healthy in these times and all the time.